Hi everyone, I'm thrilled to be here to tell you about the Global Brain Health Institute. So as Howie mentioned, unlike everyone who's spoken to you this morning, I don't have a medical background. I'm an economist by training, and up until about a year and a half ago, I worked in international development and humanitarian aid at various international nonprofits, with the last one being the International Rescue Committee in New York City, before I decided to move to San Francisco to join GBHI. So in the next few minutes, I hope to convince you that this institute and the mission were worth a cross-country move. So GBHI is an interprofessional training program for leaders in brain health. We were founded 2.5 years ago across 2 sites, here at UCSF and also at Trinity College Dublin. Our goal is to train about 600 leaders over the next 15 years, fellows who will protect the world's aging population from the threat to brain health. And we're one of 6 Atlantic Fellow programs that were funded by Atlantic Philanthropies, as Howie mentioned earlier. And so, led and inspired by the vision of Chuck Feeney, Atlantic Philanthropies funded these 6 programs to create a social justice movement to advance fairer, healthier, and more inclusive societies. And so first we have GBHI for equity in brain health. There's also the International Inequalities Institute at the London School of Economics, looking at social and economic inequality. The Equity Initiative in Southeast Asia focuses on health equity, and the Health Equity Initiative in South Africa, Takano, really looks at the social determinants of health. The Social Equity Initiative in Australia at the University of Melbourne focuses on working with Indigenous communities. And finally, the Racial Equity program at Columbia University and the Nelson Mandela Foundation in South Africa looks at racial equality. And so all of our work is supported by the Atlantic Institute, which is based at the Rhodes Trust in Oxford. And the Atlantic Institute really works to connect the 6 programs and our fellows into a network of courageous leaders who will tackle these important challenges. So we at GBHI are looking at the enormous challenge faced by the fact that within the next 30 years or so, over 100 million people will be dealing with dementia. And because aging populations are increasing more rapidly in low and middle income countries, the burden of that challenge will really be faced by those countries that have fewer resources to deal with the challenge. And so what we're doing is we're having, so this is our first class of fellows, started in September 2016, and it was a class of 28 remarkable leaders. Our second class started this past September 2017, and it's a class of 24 fellows. Now, these fellows are selected because they're leaders within their profession. However, they are in kind of the earlier to middle stages of their careers. And as you can see at our cohorts by region, the 52 trainees have come from all over the world, really with a focus on Latin America, the Caribbean, and the Mediterranean region. So we have fellows from Cuba, from Colombia, from Spain, and there's also a wide diversity of profession, because we really want to take a multidisciplinary, interprofessional, global health approach to this and make sure that leaders from the arts and public health and psychology and anthropology are working together to tackle this challenge. So once they get here, to UCSF or Trinity College Dublin, what do? So they have a structured common experience, which is common across all fellows and across the 2 sites. This includes coursework, which is taught over tele-video conference every week. And so they get to connect, the fellows here at UCSF and at Dublin get to connect with each other. There's leadership training, lectures and seminars and clinical experience. And then there's the individualized training, which is really activity-based, lots of mentor support, and includes a pilot awards program, which helps then link the fellows back to their home countries because they get the funding and then implement the pilots in their home countries. And of course, the reason why we can have this beautiful training experience here is because of all of you, and then because of all of the experts that you've heard from today. So thank you so much. You're really all part of this mission of what we're trying to accomplish. So I have just a few minutes left, and I'm going to introduce you to a few of these fellows. First, we have Mircea Balasa, who's actually an alumnus. He's originally from Romania, but now lives in Barcelona, Spain. And so he's recently returned back to Barcelona. He finished his fellowship at Trinity College Dublin. He returned back to Barcelona and is working at Hospital Clínic in Barcelona. He was funded a pilot, and he will be working to improve diagnostic capacity at primary care level. Next, we have Ana Margarita Rodrigues Salgado, who's our fellow from Cuba. She just finished her fellowship and is returning back to Cuba, and she has applied for pilot funding to validate a TAB-CAT brain health assessment developed with researchers here in the Cuban population. We have Krista Harrison, who's an American fellow based here at UCSF, and her area of interest is policy and palliative care. We have Jeronimo Martin, who's based in Trinity College Dublin. He's an emergency medicine doctor from Mexico, and he will be working and looking at stroke. And so that's it. I just wanted to say, and not to steal your thunder, Howie, but I think that one of the best examples of our interprofessional approach and really the brilliance of our fellows is our next speaker, Josh Kornbluth. So I'm really excited that he will represent his fellow fellows. Thank you.